Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is sickle cell ulcer. In this video, we will talk about sickle cell anemia, pathogenesis, diagnosis, management, and its treatment. So let's start the video. Sickle cell ulcer. Sickle cell anemia, sickle cell ulcer are a complication of sickle cell anemia, an inherited genetic disorder of oxygen-carrying hemoglobin in the red blood cells. This disease is seen in two main forms. Number 1. When individuals receive a gene from the abnormal hemoglobin from both mother and father, called homozygous sickle cell disease. Number 2. When individual receives only one gene from abnormal hemoglobin from either parents, called heterozygous sickle cell disease. So this is the example and definition of sickle cell anemia and sickle cell ulcer. Important note, sickle cell anemia was first reported in 1910 by Dr. J.B. Herrick. This is the most important point, our MCQ basis question. Now, what is prevalence and incidence? Patient with homozygous form of sickle cell disease is most likely to develop sickle cell ulcer. Disease occurs mainly in blacks. Approximately 2 million Americans have sickle cell trait or in 1 in 12 blocks. Number 2. Lower extremity ulcer in young black patients, especially males, could be due to undiagnosed sickle cell diseases. Now, moving toward ulcer pathogenesis. When red blood cells and its hemoglobin give up oxygen to tissue, the abnormal hemoglobin causes red blood cells to distort and become rigid. This results in cell becoming deformed into sickle cell. While cells are in sickle-shaped, they tend to increase blood viscosity and become sticky. This results in slowing of blood and clotting, which results in ischemia of tissue and organs. Over time, patients suffer repeated episodes of pain, tissue down age, and eventually organ failure. Although exact causes of sickle cell ulcer are not clear, they have been associated with trauma, infection, severe anemia, warm temperature, and venous insufficiency. So this is the basic pathogenesis of sickle cell ulcer. Moreover, it is also suggested a reduced amount of nitric oxide can result in unrestrained vasoconstriction of small vessel, ischemia of skin, and skin necrosis. Now moving forward, conditions associated with sickle cell anemia. What are the complications and its causes? Number 1. Crisis with fever and pain cause sickling of cells due to abnormal hemoglobin. Number 2. Pregnancy and fertility problem cause uncontrolled sickle cell of cells. Number 3. Increased infections, pneumonia, UTIs cause deficient immune response. Complication number 4. Pulmonary infarction. Its cause is ischemia of lung due to the sickle cell emboli. Number 5. Jaundice, hemolytic anemia, gallstone production. Number 7. Hepatitis, multiple blood transfusion. Next one is anemia. Its cause is hemolysis of abnormal cells. The last one complication is folate deficiency, and its cause is high folate requirement of hemolytic anemia. So this is the complications and causes of sickle cell anemia. Now what are the diagnoses of sickle cell ulcer or anemia? The first one is medical history. Patient's medical history is recorded first of all, and events surrounding ulcer development is investigated. History may include number 1. History of lower extremity edema present or not, unexplained swelling of hand, knees, osteomyelitis, joint pain, fever, etc. How long has ulcer present and how did they look? Now the third point is pain. Although sickle cell ulcer tend to be painful, pain assessment is an area that must be looked. How looked? If provider does not address pain problem, many patients will not return for follow-ups. For pain, significant debridement must be done with some types of anesthesia such as topical anesthesia or ointment, etc. Now the third one is topical oxacillin ointment or EMLA cream should be applied for 4 to 6 hours. Opioids, analgesics, and regional medications are also useful. Sickle cell ulcer are extremely painful. Evaluation and treatment of patient's pain should be top priority. What are the treatment of sickle cell ulcer? It should include most sickle cell ulcer will heal with prolonged bed rest, basic of good wound care, include debridement of revitalized tissue, control of infection, insurance of adequate circulation, and maintenance of moist wound environment. So, this is the basic points of every wound care treatment. Number 3. Use of dressing that enhance autolytic debridement. Number 5. Debridement with sterile methods. Number 6. If wound is infected, topical antimicrobials should be considered. Number 6. Oral or IV antibiotics in case of leukocytosis, cellulitis, or fever. Number 7. Silver alginate and hydrocolloid are formed in case of excessive drainage. Number 7. Dressing containing cadoximers iodine are useful in treating wounds that are critically colonized with bacteria. Number 9 is use of tissue engineered skins, and it is noted that sickle cell ulcer treated with tissue engineered skin seem to have more normal appearing in stable scar. Number 10. Hydroxyurea improves symptoms associated with sickle cell disease but also this cause leg ulcer. Number 11. Split thickness skin grafts and pinch grafts are also useful. Number 12 of treatment point is watch for signs of swelling in the lower extremities. Edema is the single most common occurrence prior to reoccurrence of an ulcer. Number 13. Wear sport case or elastic wraps. Number 14. Seek medical care properly from any minor injury to the extremities. So this is the basic lecture and simple lecture of sickle cell ulcer or sickle cell anemia, in which we will discuss its diagnosis, treatment, management, and pathogenesis. I hope guys you like this video. Please share with your medical friend. Thanks for watching.